Hi, everyone. Welcome to our live Q&A session with Angie Lorenzo from the Arizona Department of Health Services. This is the live Q&A to session E2, which you just watched. And again, it was a really great session, Angie. So this is an opportunity to ask some questions directly to our presenter. We are recording this for if you need to go back and check any of the responses or other comments that we'll be discussing throughout our time together. So from there, we can go ahead and also let us know if you have any questions that didn't make the questions tab in the video session. You're welcome to put it in the chat box here. So I will be happy to go ahead and post the first question that one of the first questions that we got in the video session, which is, why are the percentages of Latinos and American Indians presented in the sexual reproductive health charts higher? Are there any factors present that lead these groups to make those decisions?
Yeah, that's the million-dollar question, right? We don't know. We don't know what contributes to that because they're not the majority of the population, which is interesting. But for some reason they come up as the highest in those sexual and reproductive rates. But I don't have an answer for that. I really don't know what would cause that. I wish I knew we could solve a lot of things that way.
Thanks, Angie. I'd be happy to throw in a question. Regarding the youth mental health first aid, you mentioned that there were stipends of $1,000 that were offered. Can you just clarify to who they were offered and what those stipends were typically used for?
Yeah, so we had 13 county health departments, teen pregnancy prevention health educators that were trained, and 2 community health educator organizations that were trained in counties that didn't have teen pregnancy prevention contracts, but they were still teen pregnancy prevention folks. And so the $1,000 stipend was given for every training that they delivered. And it was just a straight stipend that was given to the organization to utilize for any of their needs for the training. So they could use it to, incentivize people who attended. They can use it for travel. They can use it, to pay for food, snacks, whatever they needed to. It was just $1,000 stipend.
Thanks for clarifying. I think people are always wondering, like, how would you use those funds, or what could it be used for, or any other creative ways to incentivize participation in that type of training. The other question I had was regarding youth councils. Can you clarify who were the kind of the sponsoring or organizing agencies or groups that were leading these councils of young people?
So we had a solicitation that went out, and out of that, 4 organizations were selected. So one of them is a rural county health department who is establishing youth councils, both in the 2 of them, but one in the northern and one in the southern part of their state, which are very diverse populations. We have another one that is a community-based organization in the southern part of the state on the border. And then we have another one that is working with DCS kinship youth to develop their youth councils. We're just getting them started, so we're really looking forward to seeing all the work that's going to come out of them.
Sounds exciting. Yeah. We did have a question that came into the chat around the needs assessment. Was that your required MCH needs assessment that is conducted every 5 years? What did you do to ensure the youth voice and probably this is aligned with other states' experiences where they're not able to expand the needs assessments to get youth involved to that level. So can you elaborate a little bit on how you were able to make that happen in Arizona?
So the youth voice really came from focus groups and from individual interviews with youth. So there were those focus groups, and I'm trying to get back to my PowerPoint so I can see where that came from. But we were able to go to various rural counties across the state and conduct the focus groups with high school youth, some justice system youth, pregnant parenting teens, and then in our adolescent health conference that was held that year, we also had a few youth attending there that also participated in those sessions. We had like 2 or 3 sessions for that where we conducted interviews there as well.
Great, thank you. And I appreciated the legend, the mapping of the different types of ways that you engaged youth voice in the needs assessment. So thank you for sharing that. I think it's important to show that there's different ways to collect information and perspectives and different methods when doing the needs assessment. There's not like a one type of approach that's going to get you all the information that you need.
Right, because there were always also surveys that went out, now that you mentioned that. Surveys that went out through all our stakeholders, asking them to also get input from youth in that perspective. So that was another way that we also got that youth voice.
Great, thank you. And I want to say that there's always opportunities to engage youth voice in continuous needs assessments. We don't have to wait every 5 years to get information on what their perspectives are, or what their priorities are, or what are ways to implement or develop innovative strategies to address some of these issues, especially as we're coming out of the pandemic. And as you alluded to in your presentation, Angie, a lot of the focus on mental health, even prior to the pandemic, and how we really need to see how youth want to shape the interventions or what efforts will work or will reach them as we get into this more of a recovery phase from the pandemic.
Yeah, definitely, definitely. We're currently conducting focus groups for our stigma reduction campaign. And so that is one of the questions that is being explored with the youth, is really what are those needs and around the pandemic, and how has that affected their mental health or their social, isolation kind of aspects.
So I was checking the questions tab. I don't see any new questions that have come in, but we'd like to open up the floor to those of you that are in here. We have about 20 individuals. So if you have any questions that have bubbled up as you've watched the video, please feel free. You're welcome to raise your hand, take yourself off mute, or you can also post your question in the chat box as well. And there's a comment in the chat box around asking them, youth, how we can help you get what you need, rather than, here's what we can do for you. And I think sometimes we run into that mode where we feel like we need to do everything on their behalf, or we're here to serve them, when sometimes we just need to listen, and they can direct us to where we in what ways our role, whether it's at the health agency, community-based organization, what ways that we can help influence that change, or provide that authority, or leverage our influence to do so.
Yeah, exactly. And it's interesting because it's something that we really have to work on. Like when we do conduct focus groups, like, I'm a proponent of anytime we're going to do a campaign or anything we do, we have to talk to youth about it, right? Especially if it's directed to them. And so that's especially true, and it's almost like a separate training component, because we don't conduct necessarily the focus groups directly out of the state health department, right? We'll contract with a research company or something like that. So then it's like this whole training component to them right? About this is how we want to approach them when we're conducting these focus groups, because they don't, a lot of times they haven't worked with youth. And so they're trying to maneuver it and maybe not saying exactly the right things all the time.
And there's a question in the chat box about sharing more about your last point on how you'll be supporting youth coming out of the pandemic.
Yeah, and
sorry, Angie, that's me. Of course I have, the attention span of a quarter second, but right before you responded to that last question, you were sharing about some things, and I just didn't catch all of it, and I would love to hear that again, if you can think back to what that was.
Yeah, thanks, Nate. I think my comment was we're currently in the process of conducting focus groups with youth to inform our stigma reduction campaign. And so some of the questions that are in that focus group is around the pandemic and what their needs are, how it affected them, and what resources or information they need to help them kind of maneuver through whatever was experienced during the pandemic.
It's wonderful. Thank you. I can't wait to see what they teach us about that. That's going to be phenomenal going forward. Thank you.
Thanks, Nate.
There's a question that just came in on how do you typically recruit for the youth focus groups? Do you have any tips or tricks on best ways to get diverse participation, which is really critical?
Yes. Yeah, that's really has been challenging, I think, for us. But we've been fortunate in that, the state has a lot of youth groups already established. One of the things that made this in particular a little more challenging was the fact that we didn't really want to approach any of the groups that were savvy about mental health. We really wanted to approach those youth that didn't know anything, right? And so we linked the focus group company with like our teen pregnancy prevention programs. Some of them have youth councils established, our tobacco youth groups. So any youth group that we have in any part of the state, we connected them all. Here's a youth group. Talk to them, they can recruit some youth for you. We reached out, we internally in our bureau have the Children in Special Healthcare Needs program. So we reached out to them, who they hooked us up with a couple of organizations with 360 Disability, and I think it was the Special Olympics, to try and help us recruit for those groups. We reached out to our Intertribal Council of Arizona to help us recruit some American Indian youth. So really just tap anyone and any stakeholder we have that we potentially think could help recruit youth.
Okay, response. So input from actual adolescents, so that's good there.
Thanks, Angie. Again, if there are any additional questions, you're welcome to, you can raise your hand. If you know how to use that function in Zoom, you're welcome to come off of mute, and you're also able to put your question in the chat box so that we have a record of it. And while we wait for any more questions that might come in, I want to say thank you again, Angie, for your presentation. I think it was very creative in how you were able to thread something, the topic that's really top of mind right now around mental health in young people in those existing initiatives that are reaching young people for different purposes, and how this is really a universal, a critical issue that's universal for all young people in your state, and just the way that you are able to be creative in leveraging what you already have access to, what you're already funding, in order to ensure that you're getting their perspectives on what their mental health needs are, but then also finding what are those strategies that might help alleviate some of the mental health crises that we're seeing have exacerbated because of the COVID pandemic. So thank you for that.
Thank you, Viviana. It's been fun to be creative in that sense.
Yeah, and I think you're going to get a lot of messages after this presentation. Because I think that's important as I think it's for maternal and child health and related public health partners, we're trying to find what is that role. Where is it that we can support mental health needs within our space, within our capacity, within our bandwidth? And so just trying to figure out, you know, we don't have to do it all. There are ways that we can partner with others that can help with that outreach, with that messaging, with that intervention development, with, you know, linking providers into quality healthcare and supports for screenings, referrals to treatments, and so forth. There's a question that came in. Are you documenting your efforts to get the input of youth community in a way that other entities can replicate the process?
So the input, like for example, the focus group input, of course, will come in a report that, you know, we can always share that report with anyone who is interested. And, you know, we can always share, like if there's, you know, we have moderator guides on what's being asked, you know, where our groups are being held, all that kind of stuff, that we can always share that information. Yes. And happy to.
All right, and I'm just checking to see if we have any additional questions that have come up in the questions tab, and I don't think there are, at least not on the conference website. Are there any additional questions from the audience? Okay, we have another question that came in. Are you breaking down the age groups you enlist?
Yes, that was a big discussion that we had on really how to do it. And we kind of settled on breaking it up between 6th and 8th grade, and then 9th through 12th grade, right? I mean, when you have limited funding, you know, you do the best that you can. And so we talked about, you know, well, what about if we go age group? But then there was discussion about how, you know, with COVID, you know, maybe a 13-year-old now, maybe not as mature as a 13-year-old pre-COVID, right? There's kind of that socializing that's kind of affected that. And so we really just decided that maybe instead we would go by grades. So we recruited 6th to 8th in one group and 9th through 12th in another group. Multiple groups, of course, but in that age breakdown or grade breakdown.
Thanks for clarifying. And I know there's a comment around having AMCHP share on how to get youth voice in the needs assessments. And I do want to say that that is definitely something we were trying to do even with the last needs assessment. And as we're seeing more and more adolescent health priorities really bubble to the top, there's definitely an opportunity to ensure that we are mobilizing state Title V maternal and child health agencies and partners to be accountable in including that voice, and not just one or two people representing a whole demographic, but really thinking about diversifying the outreach, the input, and because youth are not a monolith. And so I think, and they can provide a lot of great perspectives on what will work for themselves, for their peers, for others that they can advocate on behalf of. So we are definitely trying to really drive that home, especially for you know, what should be a continuous needs assessment every year for state health departments, not just waiting every 5 years to remember to include the young people in that data collection and strategy, you know, and strategy development.
Yeah. Andrew, I agree. Maybe we can make that a requirement. Maybe AMCHP can make that a requirement in the future.
We can definitely promote that. I think, you know, and thinking about what the federal block grant entails, I think we can definitely advocate for that to be a requirement, or to be more thoughtful in how we include consumers, stakeholders, youth, families in that process.
Yeah. I
see some comments coming in, you know, how can we make this a requirement for other funded initiatives? Absolutely. I'm just making sure I didn't miss any additional questions. Are there any other questions that from the audience? All right. Well, I want to put something in the chat box. We actually spotlighted Arizona's MCH approach to adolescent young adult mental health a couple months ago. It's a blog post, and it helps summarize a lot of what Angie covered in her presentation that you witnessed now, but just an opportunity to go back, so this is like more of a summary to Angie's presentation, but just a lot of great work, again, in braiding and threading that mental health perspective across existing and new and upcoming initiatives that are focused on adolescent health. So just a great way to find a summary of that, of what you just heard as well.
Being a broken record helps as well, right? Squeaky wheel gets, what is it? Squeaky wheel gets the oil kind of thing. And just really seeing opportunities within the agency. I mean, recently we had some, I think it was through our marijuana sales, a few million that came through for suicide prevention, but to a different bureau within a sister bureau, right? And it was like, well, how do we get a hold of that money, right? So it was just calling, bugging, and we finally got some money for it, right? So it's just really being that one that, they say, give us your MCH budget, and I over budget by 500,000, right? And then in the end, they're like, okay, well, we can't give you like all of that over budget, but where can you reduce it a little? And maybe I can give you 200,000 more than what you normally get, right? So it's just really just that squeaky wheel, and just making sure that, that it's in the forefront and people are understanding how important youth are, and, the forgotten age, right? As we keep saying. So it's just continue to talk about it.
Absolutely.
Lots of money, Andrew, but mostly for teen pregnancy prevention. That's our challenge.
I think we had a few additional people join our Q&A. I wanted to see if they had any questions that they'd like to ask Angie while we have her here live, or any comments or any words of wisdom. I don't see anything coming into the chat. All right, well, I think that this is a natural time to go ahead and wrap up. So we'll go ahead and we'll stop the recording.